Hello, my name's Ellie. I'm a chiropractor and a Pilates instructor. I think we're on day 24 of this lower back pain challenge, so well done if you've made it to this far. Today, we're actually going to be focusing on the hips. Now, I know that seems slightly irrelevant from the lower back, but we're more specifically going to be looking at some of our hip flexors. So some of our hip flexors actually attach off the lumbar vertebra, and they sort of wrap around and they attach onto sort of the greater trochanter. So they do this sort of like whoop, and that's what helps us lift our leg up or flex our hip. So quite often we get sort of pain referring around to our hips. If our hips are a bit tight, it can affect our back and vice versa. So we're looking at this whole sort of area as a complex, and today we're going to be focusing on those hip flexors. So first things first, we'll get the spine moving and then we'll get down into the hips. If you have any health conditions, please just make sure that, or any injuries, just make sure you are signed off by your healthcare professional to join in. And if you're going to do this anyway at your own, just do it at your own risk, okay? So let's start standing. Let's get the spine moving. Head is going to disappear, you do not need to see my head. We're going to do feet hip distance apart, hands down by the side of the body, standing up tall. Take a breath in through the nose, and then as you breathe out, you're going to start to bring your chin towards your chest. So it's just going to initiate our first roll through the spine, just bringing a bit of flexion into the spine. Moving it into the mid-back, your lower back, just letting everything sort of curve and hang down, letting everything drop and decompress. Let your head go, feels good. Take a breath in, and then on your breath out, slowly restack, rebuild your spine vertebra by vertebra until you're back up to standing. We're going to stay down on the next one. Take a breath in, breath out, chin to chest, peel yourself down, steady breathing in through the nose, out through the mouth. Come onto your hands and your knees. So by now you should know I like a roll down and I like a cat cow. We're going to do one cat cow just to set the position of the spine here. Hands underneath the shoulders, knees underneath the hips. Relax the tops of the feet down into the floor and just keep the elbows a little soft. Take a breath in, start to arch the lower back, lift the crown of the head and the tailbone up to the ceiling. And then as you exhale, we're going to tuck your tailbone down towards the floor. And then you're going to find somewhere in the middle of these two positions. That's what we're going to work in. We're going to call that our neutral spine. It doesn't really mean a lot, but we're going to stay in this position. And I want you to imagine you have something now resting on your lower back. A cup of tea, cup of coffee, glass of wine, whatever you prefer. You're not going to lose that. It's going to stay here. So no shifting, no arching. We're locked into this position now. We're going to take our right thigh bone backwards. So I want you to inhale, float that right thigh bone backwards. Try not to change your body shape as you do this. We've done this before. Breath out, take that leg down. Same on the left side. Take a breath in, floating that left leg backwards. And breathing out to control it down. Right side. Breath in. Really trying to keep the hips still. It's actually very difficult. Breath out. If you're thinking about just moving from the thigh bone, left side. Breath out. Now, one more on each side, just like this. Take a breath in. Right side. Breath out. And left side. And breath out. Now, we are going to try and keep the hips still, but this is going to be quite a lot harder, so don't worry if there's a tiny bit of movement. We're going to float our right leg back, and now we're going to try and bring that knee to the elbow. So as we bring the knee to the elbow, obviously our pelvic position is going to change, but I don't want you to lean over to the left. Just going to try and draw that knee in, and then take it back. I'm going to do that twice more. So if we just let ourselves move, I'd be seeing this going on, woo, I'm compensating through the body. We're just trying to move through the thigh bone. It's really hard. I have to reset myself because I've already moved a little bit, or I want to move. So we'll do 2 more of those. So you're going to bring that knee to the elbow, or as far as you can, and take it back. Once more, knee to elbow. This time extend the leg out to the side, pop it down. You're going to sit your hips back as far as you can here. So you can let the sort of pelvis tilt in any position that it feels comfortable in order to just draw the hips back. And you might not get all the way down, you might do. You're going to slide your hands forwards. We're in a nice modified child's pose. This is actually going to stretch the inner thigh more than the actual hip. but it is all connected. We'll just stay here for a moment. Steady breathing in through the nose and out through the mouth. Okay, come up. Let's do that on the other side. I'm just going to turn myself around because I do not have room to extend my leg on that side. So finding your sort of neutral-ish position, somewhere between that cat and that cat. From here, we'll extend the left leg out towards the side. Try not to lean with this, keeping the body still. From here, knee is coming to elbow on your inhale, or thereabouts. And then on your exhale, coming back. It doesn't have to touch because we're going to try and keep the pelvis, the body and pelvis relatively still. Taking it back. Once more, bringing it in. This time extending the leg out to the side, sitting the hips back as far as you feel comfortable, sliding the hands forward. Okay, bring yourself up to kneeling. So, coming onto the knees, grabbing a pillow if you need to, because we are going to be on the knees for a little while. You're going to place your left leg forward. As you do this, just make sure that that left hip doesn't try and pop up off the floor. We want the hip bones to be relatively level here. They could be a little bit off, but try to line them up slightly. And then you can tuck these back toes, and I want you to imagine your pelvis as a bowl of water. So if I just sort of hang out however was comfortable for me. I like to have a little bit of a tilt. It means all that water in my pelvis bowl would be falling out forward. I want to try and balance it. So I'm going to slightly just bring my tailbone down towards the floor, so I'm sort of tucking everything underneath. It does feel a little bit like I'm doing this. I'm going to just try and avoid sort of rounding forward through my shoulders, but it's making me feel quite a deep pull in my right hip. If that's not the case for you, I'm going to try squeezing your butt muscles. Sometimes that just helps a little bit to open that up. And if you are not feeling a stretch here, just try sliding that front leg forward slightly and coming forward slightly as you keep that level through your pelvis and you squeeze your glutes. We're looking for a gentle, could be quite intense to be honest, some sort of stretch in your right hip. And just hold it here. Now if this feels okay, you're going to keep coming forward. Ooh. And you can lean onto your front thigh with your left arm, and you're going to take your right arm up and over, coming straight across the side, not meaning leaning forward or leaning back, so it's just stretching into our psoas muscles slightly, one of our big hip flexors. Keeping your chin and your chest lifted. And then we're going to come back straight away. Find that position where your pelvis bowl of water is balanced. You might need to bring that front leg in a little bit more. We're going to lift this back knee off the floor by 1 inch and just hold it. So just want you to lift that knee, hold it there for 10. Think about your bowl of water. 9, 8, steady breathing. 7, 6, 5, 4, 3, 2, 1. Well done. Okay, bring that leg back. Let's switch it over. We're going to bring the other leg forward. Again, we're looking for slight right angles to start off with. You can tuck these back toes, ready for that lift. Hip bones level. So for some reason, my right hip really wants to be up to the sky today. So I'm having to level, tucking the tailbone down slightly. If your bowl of water is falling out forward, as mine is right now, so tucking underneath slightly, just a little bit. Think about it as a bowl of water. From here, if you're not feeling a pull here already, try squeezing the glutes. If you do not feel a pull there, bring this leg forward a little bit and start to come forward. Yep, I can feel that now. And then from here, if you feel all right here, you might just want to stay here, but if you feel okay, pop the right forearm onto the right thigh. Big stretch up and over to the left. Chin and chest lifted. We're thinking about really stretching the psoas, which comes from around here onto that greater trans, onto the sort of the thigh bone. So it's coming round. then for the fun part, coming back, leveling, tucking the toes if you would like to, lifting for 1 inch. Keeping it level for 10, 9, steady breathing, 8, 7, 6, 5, 4, 3, 2, 1. We will leave it there for today, guys. Fantastic work.